You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I'm sitting down with Rich Palarea, who is the CEO and co-founder of Kermit. Welcome to the show, Rich.
Thanks, Roxy. It's great to be here. Thanks for having me.
Okay, so the first question I'm going to ask before I get into my normal question is, why Kermit? What's up with this name?
Oh, you went right for it right out of the gate. Okay. Well,
Yeah.
we were kind of talking in green room before you started recording, and we were talking about how you like to kind of keep it real.
Yeah.
We're all people, right? And healthcare could be a little bit stodgy and kind of conservative. So when we started this program, one of the things we noticed was that healthcare supply chain really disliked doing the service and the job that we do. They're tasked to do it, but they don't do a very good job with it. They really don't like doing it. And so when we arrived on the scene with our offering, we thought we kind of take away all the cares and the worry that they have. We need something that resonates with some kind of a simple name. Everything in the environment was all acronyms and people took themselves very seriously, and we take ourselves seriously when we do our jobs. We are very accurate with our data. We're very precise, but not with us here at work. I mean, everything is fun. We have a lot of fun and a lot of innovation. So we were sitting around. I was with my two co-founders, and we said we need to name the software. What do we want to come up, with a name? And it was kind of like naming a band. So we all sat around, got something to drink, and started throwing out names. And I said, "Stop! We could be doing this for hours. Let's set some parameters." I said, what kind of comes to mind is at the beginning of the movie, I think it's Spielberg, where there's a child sitting on the edge of the moon, and he casts a fishing rod out, and the hits the water, the ripples go out, and the music plays. I said that gentle feeling of everything being taken care of. That's what we do for the hospital. So let's come up with a name that reflects that. And I have a very impetuous partner who said, Kermit. And I said, okay, we'll never get a trademark on that. That's crazy. And we all laughed at him. And then we went on for like 10 minutes, didn't come up with anything better. And we said, you know what? That could work. If we could pull it off, it'll work. And if I could turn my camera around to my bookshelf, you would see my customers have sent me all kinds of frogs and different things. And so it's a name. I think it really endears itself to what we're trying to do. It's memorable and it's fun. And that was really the basis behind it. It was nothing more scientific than just that. And I think it's kind of worked for our brand.
That's awesome. I love that we just jumped right in and we started off with that creativity and that fun. So what do you do? Tell us a little bit about your background and what Kermit is all about.
Sure. Well, I'll start with Kermit. It's an interesting approach. It has never been done before. When implantable medical devices, things like knee, hip, spine, cardiovascular implants are used in surgery, there typically is a salesperson for the implant company that stands in the operating room with the surgeon. They're there to make sure the surgeon has everything he or she could possibly need for that surgery. Nothing could kind of be a curveball or go amiss. What we don't talk about is the fact that most of those salespeople tally what's being used in surgery on a piece of paper. Even today, with all the electronic medical records and all the innovation we have, it's a paper-based billing process where barcode stickers are taken off the implant boxes as the surgeon calls for the implant, and they're affixed to a piece of paper. And then the sales rep writes down what they're going to charge, and they march that piece of paper from the operating room down to the buyer's office and turn it in and expect to receive a purchase order. It's all handwritten. There's no way for a buyer who's not a clinician to understand what's on that page. Did they use 5 screws, 6, 12? I don't know. Who counted them? We don't even know if the price is right. And so they've got to adjudicate in real time this piece of paper and make a determination. And when you think about an average hospital, not even part of a large health system, just a regular regional medical center, maybe doing 50, 60, 70 surgeries of all different types, trauma, orthopedics, spine, cardiovascular, biologics, breast implants, all this different kind of stuff. That's a lot of paper to go through. And so what Kermit does is two primary things. The first is my two co-founders were former med device reps. doing this silliness that I just described to you,
Yeah.
but they understood what the price point ought to be. In other words, the street price. If they had two hospitals in the same region and they were both buying the same implants, but hospital A was paying a higher price than hospital B, which is typical, they knew that discrepancy. So what we decided to do is come up with a consulting effort that would level the price out based on the performance of the device itself, regardless of who the manufacturer is or what the shape or the material or anything. It was just regardless of that, it would be one price. And so we come up with a consulting and a negotiation process where we can actually issue the bid and manage all the negotiation on behalf of the hospital. So they don't kind of have to get their hands dirty with their vendors. They just have a nice vendor-client relationship. If we save them money in that effort, we get paid out of the savings, period. We don't get paid for anything else. So it's performance-based. We have to perform. Number two, we always thought that paper-based process could be different. So we've designed, it's taken us a while, but we've designed a piece of software where we give the rep in the operating room an app that goes on their phone, and they tally what got implanted into the patient, and they take a photograph of the paper bill sheet using the same technology you and I use to deposit a check. So there's nothing resident on the phone.
Yep.
And then that goes up to our software, which then automatically adjudicates the bill, tells the hospital what's okay to pay and what isn't. Things like Johnny falls off a trampoline, breaks his wrist. The surgeon uses a 3-hole plate to fix the bone.
Yep.
But why are there 4 screws and there are only 3 holes in the plate? Like Kermit's smart enough to know that kind of stuff. Yeah. Or there's 2 femoral components on a right total knee. It's an anatomic impossibility. One of them must have been dropped on the floor or wasted. So it rolls through that, it corrects the bill, and then it shows that to the hospital, and they then approve it for payment. There are a lot of analytics, as you can imagine, that come out of that process, opportunities to sit with surgeons and show them what their decisions on their feet cost the hospital in real dollars, and even alternatives to what they're selecting, which have just as good of an outcome, but maybe at a lower price. We don't force that on the hospital. We just have consultants that interpret that data for them and inform that data, and they can make their own decisions. Again, all of this is performance-based. So if we save the money, we keep a portion of the fee. But if they just want the software, they feel like we do a great job with pricing, we just want your software, we'll sell it to them on a subscription basis.
So do med device companies like you?
Well, some of them do. Many don't. Obviously, we're kind of in their pocket, so to speak, taking away some margin. But in almost every situation, in every major hospital, you have kind of an incumbent who's getting most of the work, and some challenger brands who just want a fighting chance to show that they can meet the price, they can do a great job. So our bidding and our consulting effort levels the field for them. So in one case, you might have a very large company say, we'll give you everything you need, just give us a shot. And then we show up at the next consulting project, and they're the incumbent and they're fighting us. So it all depends on what the dynamics are. But, by and large, I think 10 years ago, the device companies did not like us. I think where we are now with the price pressures that hospitals are facing, 50% of all hospitals, Roxy, last year posted an operating loss. That's not even sustainable. So I think that everybody is saying, how can we ensure that our hospitals stay in business? They're there to provide service to the population. Because if they're not there, doctors don't have operating rooms to operating in, and implant companies don't have places to sell their implants. So the whole thing kind of comes down. So everybody's gotten much more practical post-COVID with that. And I think it's even changed the dynamic of how we position ourselves in the market too. I am finding we are more of a facilitator to the transaction than a crusading cost reduction company, if I'm being honest.
Yeah, that makes sense. So take us through that commercialization journey, right? You talk about 10 years ago. When did you get started? And, we don't need to chronicle every step, but, give us the highlights of those early days and some of those decisions or challenges that, obviously you're bringing something like that's never been done before to market. And so, how were you packaging that and presenting it to folks, how well it was received, and maybe some things that you did to tweak and finesse that commercial strategy to kind of have it click and really start to see some paying clients come in?
Sure. So I was running another consulting company that had a very similar model, but I was doing it in transportation and logistics when I met my two co-founders, I was negotiating FedEx, UPS, DHL contracts for
Mhm.
some of the largest shippers in the US and taking a portion of the savings as my fee. And I'd done that for a long time. It was a great business. I didn't have any designs on selling it, but when they walked in and told me this crazy story about how they stand in the operating room with a surgeon, I went home that night and I thought, I'd be kicking myself if we don't try this. We could
Yeah.
really fundamentally change the way this is done. And so I agreed to say, let's set up a joint partnership and let's just kind of see where this goes. Very quickly, we landed two hospitals here in the state of Maryland where we are located. And that just put enough revenue into the company for us to not have to go find an investor. And we just kind of took off. Their fundamental objective when they came to me was, we know what the price ought to be and nobody's paying that price. So what if we just consult and get the price to come down? So the initial offering was just a consulting offering.
Mm-hmm.
What we found very quickly after we sold the first deal was we outstripped the ability of anything at the Microsoft Office desktop to be able to manage this amount of data. There was no Excel, no Microsoft Access, even built a SQL database custom. None of that was working. And so we originally designed Kermit, which is the software, to be able to roll through all the data and calculate the savings so we could actually produce a bill. It was nothing more than that. And once we started working on the software, we then had this aha moment. We realized, wait, we have this paper-based process. We're creating a digital version of that could be a product unto itself. So let's start to invest in that. So at that point, we actually did go find an investor. A friend of mine is a former NFL player, put some seed money in. And almost immediately after that, we sat around the boardroom with our newly minted member, and we voted to become a SaaS company, a software-only company. We didn't raise enough money to do that.
Yeah.
We also went back to the market and started telling this great story with software, but we couldn't get any hospitals to buy. They just didn't want to. What they wanted was our expertise about where the tricks and the traps were and what was going on in the operating room and what was the bait and switch thing. And so we stopped fighting the market on trying to be a SaaS only thing. And we stepped back about a half step, not a full step, and said, what about a technology enabled service where we keep the good stuff that they want, but we bring them along on this journey to use technology in a better, smarter way, so that once we feed the data into this, we don't have to be there to kind of hold their hand the whole time. We can make them smarter, have them understand the data, make their own decisions, and they can own that, rather than have a consultant come in and own it and have to try to convince surgeons that we know what we're doing. So that was kind of the quick evolution of how we got to where we are. Now we're squarely a tech-enabled service. Most hospitals they're in a dire way. They just need the savings. The bigger hospitals who have a pretty good handle on contracting don't have the data. To get the data that we have, you've got to go into the electronic medical record and stitch it together with the enterprise resource planning system, which holds all of the supplies. And there's nothing in the ERP that shows who is the surgeon, but in the med record, you have the surgeon, but you don't know the price of the item. So it's a pretty daunting task to download all that data and stitch it together and have it be accurate. What we're doing with Kermit is we're capturing it at the point of use in the operating room. And we have all the facets we need to just produce a report. And I have customers who will just go into their meetings with an iPad or an iPhone and cast this stuff up on a wall. And it blows everybody's mind because it's all there in a nice, tidy KPI, a nice, tidy dashboard. It's taken them months to get that kind of data together in the past. So it's a real game changer if they use the software, but they all need the savings. And I think it's a combination of the two. That's kind of the commercial journey. It's been 12 years now. I ended up selling the other company. I wasn't being an effective CEO of two things at once. So I got rid of that. And this has been a real meaningful journey to transform. And frankly, I would say that imitation is flattery, as you know. So now we have quite a few competitors who have marched into the space, some very big ones, including some of the big GPOs in healthcare.
So how is that shaking up things for you?
I would say it probably makes it easier to sell when you have kind of a foil to fence against, so to speak. You've got other people out there telling the story. So excuse me, I think we still have this first mover advantage. We can say we were the first, we created the space. Nobody existed before we did it. They're all kind of copying us. We see a lot of stuff out there on competitor websites using our terminology and all that. It's pretty easy to point to. There's only a handful of competitors. I'd say it's less than 15 right now. But I'd say it's made the market more aware that they need this service. So that's been good. What isn't so easy is that nobody is truly defining the space yet. So nobody's really stepped in to say, when we say implant spend management or physician preference item, PPI spend management, we're really talking about this. This is the practice. This is what it looks like. So everybody has a different flavor. We have scheduling companies, surgical scheduling companies getting into this, companies that manage sterile processing and tray management getting into this. Like I said, the group purchasing organizations are dabbling. Kermit is really the only one that fully does an end-to-end process, starting with the consulting and all the way through the bill payment and then the data on the back end. And there's other things we're adding to both ends of that spectrum and that workflow to make it more of an enterprise product. So that's been hard, is kind of telling the story. When we say we do PPI spend management, we'll meet somebody who says, oh, you're the third person who showed us that. And we'll say, just look at what we have, because it's very, very different. It's a lot more detailed.
Sure. Yeah. And, kind of just to kind of emphasize what you're touching on is, when you're first to market, especially in a new category, something that doesn't exist, it's very expensive.
Right.
And it takes a lot of time to build the category and build the awareness of something. But what I find that you're doing a little bit different is that when those other players start to enter into the market, you usually have an incumbent that has a pretty significant market share that kind of gets a little fat and happy. And that's why they get blindsided, because too fat and happy. And it sounds like you guys aren't doing that. You're still paying attention to the dynamic, ever-changing customer needs and reinventing yourself to make sure that you're always ahead of those later entrants, to be able to shore up your value that you're delivering to your target customers.
Yeah, for sure. And there are even market dynamics going on. I mean, a lot of what we deal with are these mature categories like knee replacement and hip replacement. And Medicare is driving a lot of the policy about how reimbursement will come down, bundled payments, things that are quite innovative that our government does. We don't really think of the government as innovating, but I think CMS has done a really good job of trying to kind of mix up the payment models and determine, through some demonstration states like the state of Maryland, where we're kind of the one that they started with, how can hospitals do a really good job so they get measured on their performance and their outcomes, as well as their reduced price? And if they can get the price even below a threshold, they can keep that for themselves and even distribute that money to their surgeons without any kind of co-management agreement in place. So they've made it, Medicare has made it really great for companies like us to come in and innovate on the back of what they're doing. They come up with these programs, but then hospitals look at them quizzically and say, oh, we can't do that. We're a fee for service shop. We just need more bodies to come through, and we just keep doing the stuff we've been doing. They don't want to see hospitals with that model anymore, starting to penalize them for readmission and stuff. So I think it's a large scale movement, not just the what's needed at the hospital, what's going on in the marketplace, also how the payers react and what the patients want. And patients are starting to get very savvy with taking control of their own healthcare. Even companies that self-insure now, Walmart sends all of their orthopedic employees who need surgery to one particular location, and they've already structured a deal. So you watch all these dynamics. I think if you do sit back and rest on your laurels a bit, you will get caught flat-footed. I mean, just you look at something like, and if you're younger than I am, I think, but you remember the Sony Walkman.
Yeah.
We love those things, right? We all had little foam headphones and walked around with that really cool device. And then boom, Apple came out with an MP3 player, and Sony was like, oh my gosh. So that's a real threat. I think we all take that very seriously here at Kermit, and we're frequently looking for places to innovate to stay a step ahead of what's going on in the market, for sure.
Absolutely. I use Kodak and Blockbuster as like my go-to case.
Yeah, those are great ones. Yeah.
Same meaning here.
Yeah.
So I want to transition a little bit to more of scaling a mid-market company after you've achieved a certain level of success. But before we go there, is there anything else that you would want to share with our audience, innovators like yourself, probably somewhere more along the lines of 10, 12 years ago, 8 years ago, right? Much earlier stage. Are there any lessons learned that you would want to share with them? Obviously, market conditions are very different today in a variety of ways, and there are going to be different businesses. But as an entrepreneur, as a visionary leader, is there anything that you would want to share with them that they can learn from you?
So that's a great question, Roxy. We could spend a whole show doing that.
Yeah.
I'll give you a little tidbit.
Okay.
We fell prey to this. And so this is personal experience. My experience on this was this idea of an N of one. If you have just one customer who tells you, I love the product, but it's just too expensive, you got to reduce the price. And you use that and you have this knee jerk, oh, we cost too much, and you change the whole thing. You really need a lot of data to make those types of decisions. Or we use the product and it just was kind of clunky. You guys need to redesign the UX and the UI of the product. Those kinds of things are valuable feedback, but you've got to bring that together and see, is it one customer who's just very vocal, or is it the marketplace telling you you're going the wrong direction, you need to change? Here's a good example of something that the market is telling us, and we've just kind of been reluctant to do until just recently. You watch this large scale migration of orthopedic cases leaving the hospital setting and going to ambulatory surgical centers. Not so much knee and hip, although it's starting to happen, but there's lots of shoulders, tons of sports medicine cases, that kind of stuff. And so that's a different marketplace. A lot of those environments are surgeon owned, or surgeon own a majority. Maybe a private equity company owns the rest. There are definitely investors involved. They're very lean. They're really into profitability.
Yep.
Some of these surgeons will say, we'll have a healthy patient and say, I can do this patient here in my facility in a very safe environment. And I'll send the person with the comorbidities up to the hospital, let them manage the heavy costs. So you have to watch those dynamics. And we've been watching on the sidelines, watching this transformation happen, and very reluctant to get out of our comfortable place of selling to hospitals, because we understand that, and going out and selling to ambulatory surgical centers. They want a lower cost product. Yeah. So what do? Do we skinny the product down? We're just playing with ideas there. We've landed 3 so far. They're very happy with what we're doing. And we're starting to kind of get a paradigm on how we can make that move from where we are to where we need to be. But I think we're going to have a foot in both spaces and just going to have to do that for a while. So yeah, just being highly adaptive and ready to pivot, and not too focused in one place that you can't back up and change, because it's healthcare. It's always going to change. Something is going to come. It's a dynamic.
Yeah, definitely. Those were great examples. Really, really great. And I like what you're touching on, because it's a great transition for us to talk about, scaling a successful company that's cash flow positive, that's got some, quite a few paying customers. So you're talking about exploring new markets, either new markets or new solutions to existing markets, or some combination of that, to be able to, I call it, get to big money, baby. So what are some of the some other things that you're looking at that, as the CEO of the company, that are going to be fundamental, whether it's strategies or whether it's executing better, or creating more alignment as you grow and expand the organization, improving the customer experience? I mean, everything's fair game here. But what is it that is most important to you that you've seen, and being able to scale from millions to billions?
Okay, so I don't think you probably have not had a guest on your show recently that hasn't said the initials AI. Like, everybody's talking about it. Few understand what it really is and how to use it. Some are scared of it, and some think it's going to be the wave of the future. I think all those things, right? I agree with all that. We can't sit by and just say AI is going to mature and eventually we'll figure out how it fits into our world. We're taking that bull by the horns right now and building it into the software. So we're actually under contract with a third party as a very impressive product that's healthcare focused AI. And we're harnessing that product in a very specific way to read this paper bill sheet that I talked about, this handwritten bill sheet. They never show up. They're like snowflakes. No two are the same. And so the stickers could be in different places. Handwriting is never the same. Even the same person's handwriting is not the same from case to case. So it's a very complex process that for the last 12 years, we've done with a person. So when they see the picture of the bill sheet pop up, we have a data entry person located somewhere else in the US outside of our office that types in everything that's on that paper bill. We're now in the final stages of perfecting the reading of that, and actually the use of AI to make decisions about what's on that paper to help Kermit make its decisions about what's okay to pay and what isn't. So this is transformational for many, many things. It's going to reduce our internal costs. It could bring our opportunity to sell the product at a cheaper rate down, which then introduces a better opportunity for the ambulatory surgical center market, as we talked about. But lots of other dynamics around that. Then I think if you were talking about big money, I think our opportunity at some point is to become part of a larger organization. And I think you have to have an AI solution for your tech company today. If you want to be acquired by somebody, you have to at least have given it some thought and have a plan, if not have it bolted in some meaningful way into your product.
I completely agree. So I actually just have this book handy here. So this book, Hacking Healthcare, Tom Laurie was actually a guest on my show just a couple of weeks ago speaking. So he wrote the book on AI in healthcare, literally. And we talked about that. And one of the things that he said is every organization should have AI as part of their business strategy. And really, you touched on it, both internal. How are we leveraging AI for operational efficiency within our organization, as well as how are we leveraging AI to deliver more value, better value, different value to our customers or different customers. And so I love that, because I think that that is a key ingredient to be able to go from millions to billions. And it's something that every single person that's listening should be thinking of and mapping out with their own teams.
Yeah. And it's not so far afield and so complex you can't figure out a way to use it. I think the widespread example that everybody is seeing is ChatGPT. And sure, I think there's some fun things you can do with GPT. Think about it at that level, right? If you were just to have this interface where you could ask AI something crazy and just see what it comes back with, and then start to dabble with it. Pretty soon, if you get your hands dirty, you'll find something that fits in your business. Whereas before it was all hypothetical, theoretical, it was in books, it was in white papers, and everybody was like, oh, that's robots coming to take over our jobs. We don't want that.
Right.
Two very different ways of thinking about it. And the truth is in the middle somewhere. I think you really just have to kind of get in and get a feel for it. I got very involved in cryptocurrency investing many years back. And I remember, and I made a lot of money on the ledger, but I didn't sell anything. So I'm down like everybody else right now. Yeah. But what I do remember was just a small sliver of the population had even been exposed to this, and an even smaller sliver were dabbling in it. There's such a big upside for the people who come in early, who can take risk and just calculate a risk. So think about AI the same way. It's not so hard that you can't get in and figure out what's going on and understand it. And if it feels like that to you, hire a consultant, let them come in and teach you how to do it. Because I think if you have a technology company, and probably if you're just in business, period, you need to understand this today, right now.
Don't be the person with the bag phone or the flip phone, right?
Yeah, right. Hey, had a bag phone. I remember that thing. It was a pain in the neck.
Yeah, I actually just cleared out some stuff out of my uncle's house, and I came across literally a bag phone. I dusted it off and took it home.
Yeah, stick it in the Smithsonian somewhere. It's probably worth something.
Exactly. I'm sure it is. So as we kind of wrap up here, we talked about this. There's the early stage innovators. There's the hospital systems and providers that are adopting innovations from people like yourself, and then there's others that are mid-market, and they've got a lot of success under their belt, and now they're scaling into what's next. Anything else that you want to share with our audience before we wrap up?
I do wish that hospitals, and I'm gonna make a very blanket statement here, but I think you'll understand what I mean. I wish that they had a way to understand technology and take an appropriate risk. I think a lot of them will look at technology and say, well, we know we need it. We don't know where it fits. We've always done things this way. And you know what? That's just antithetical to our thinking. We're just way too busy to innovate right now. We've got fires. We've got to put out, we've got COVID. We've got nurses that are leaving in droves. We've got real problems. But I think if you had an intermediate layer, maybe a chief innovation officer in a hospital, which does exist in some places, but just a council that would look at technology as a fiduciary for the hospital to be able to quickly define these things meet our criteria, these are worth looking at, don't even bother with the rest of the stuff, and make a first cut. That would really be beneficial to many hospitals. Nobody is doing that right now. kind of at market level. Individual hospitals are solving for that, but it's hard for us to prospect who really gets it and who isn't. It's a cultural fit. On paper, I can determine almost everybody needs our product. But when I knock on the door and I show up, I don't know if the supply chain person is going to love me because I'm doing their job and I'm going to let them go to Cancun for the week, or I'm doing their job and they're threatened by what I do. And it could be just hospital A and hospital B next door to each other have a very different outlook on how we can help them. And we're just trying to help. We just want to save them money. And so I think this kind of knee-jerk reaction of, gosh, you're selling me something, I don't know if I can trust you, needs to go more toward innovation. If I really deploy you in a strategic way, what does it do for my business? Do I save money? Do I save time? Does it free me up to do other things? All of that is a possibility, but it's so hard to break through the noise. So yes, we're scaling. We're at mid-market now.
Yeah.
But yes, it's taking the few wins we've had and trying to blueprint that and figure out which other hospitals are like the ones we've already sold to who love us, and let's just spend time selling to them. It's not mature enough yet for what we're doing to just sing from the mountaintops and everybody, we're just order taking and the phones are ringing off the hook. Maybe one day it'll be like that, right? Maybe.
That repeatable, predictable model, right?
Yeah,
That we all want in our businesses.
We all want it. We do.
Well, thank you so much for spending time with me today and sharing your experience with our audience. Appreciate it.
No, it's my pleasure. Thank you for having me.